Welcome to Adapt NCLEX, and thank you for deciding to join us. Today, we're going to talk about some questions for neurology. Basically, is a concept we're going to focus on. I'm going to give you some concept questions. It's straightforward. This is just to test your knowledge, but don't let the question trick you. This is like NCLEX-style question. Very short, a bunch of information. You just have to look at the question, find the buzzword, and then be able to figure out what the examiner is asking you. Right. Number one question, and you have to participate as I just want to check your answers and to see how you're thinking. How do you want to approach this question? Just read it from the back. Which nurse intervention is most important? The word most changes everything. Most doesn't that means all these answers may be true, but one has to be the most. Whenever you see that, that's your key, right? So which of this is the most important? And then care for a client with what? Ischemic stroke receiving what? Tissue plasminogen activator, TPA. Which intervention is the most important? Then you go and look at your content. I mean, you got to bring your content. You got to know your content before you take this test. You know TPA. You have to know what it's used for. I've given you a clue. It's used for ischemic stroke. What causes ischemic stroke? It's thrombosis, emboli. So there's a blockage. Therefore, if I'm giving you something like this, TPA, I'm going to break down the blockage. It's a clot buster, right? It's going to like lysis the clot. Therefore, which of these interventions is the most important when I give you TPA? That's all. That's what you need to pay attention to. Is it bleeding? Is the respiratory rate going to go up, or your blood pressure going up, or your urine output is going to go up? Or are they going to go down? But which of these are you supposed to follow up on? That's why I said the most important intervention for this is the bleeding time, respiratory time, blood pressure, and urine output. You have to know this content. TPA, what does it do? Like I told you, it's going to burst the clot. Another function of this, it decreases your blood pressure, and that's what causes more bleeding. It's going to make you bleed. At the same time, it decreases your blood pressure. So bleeding time is not necessary. It's the hypotension causing the bleeding is the most important. The respiratory rate, this medication does not affect your lungs. It does not affect your urine output. Even if it's going to affect your urine output, it's related to your blood pressure. So you see all the answers are interconnected. So what you're going to check is your blood pressure. So that's the most important. A client with the history of epilepsy reports feeling an aura before a seizure. What is the most appropriate next intervention? Or this intervention may be appropriate or inappropriate. But which one is appropriate? Go for the buzzword. Patient has epilepsy, okay? Patient has what? Aura before the seizure. That is what the question about. What would you want to do? Do you have to apply restraint to prevent injury? You have to assist the client in the sideline position. You give the patient oxygen, or you give them phenotype. Think about it, right? Is content being used right there? And the buzzword in this question is not epilepsy, it's that one. Or is the feeling they get before they go into seizures. Therefore, provide safety preventive measures after they develop their aura, right? So restraining them is going to make things worse. You put them on the outside, it's much better. They're not going to aspirate because your esophagus will lay down, so aspiration will be prevented. You are giving them oxygen is not going to help them right now, okay? It's not going to prevent the seizure. The seizure is coming, so giving them oxygen is not. You give them oxygen after the seizure. And phenotype takes some time for it to work. So giving them that, even if you have to give them medication, you have to give them benzodiazepine. So Lorazepam is the medication of choice. Anxiolytic in this case. if patient is having acute seizure. So this question, we got to lay them on their side. And this is the explanation. This is part of a because on demand, you get access to these questions easily. This is another one. It's a straightforward question. It's loaded. It's case-based. It's content-based, right? What medication should the nurse anticipate administering to prevent what future episode? Keyword future episode. If you read a question, try to figure out what the question is asking. The question says future episode. What happened? The next care for a client recently experienced what transient ischemic stroke. This is TI. This is the early onset of stroke. It's a warning sign that you got to have stroke. You remember you have angina, then you get a heart attack, MI. Well, the stroke, MI, before you get full-blown stroke, you get TI, which is a form of an angina to your brain. And therefore, what do you want to do to prevent it? The answer choice is based on management of preventive measures. I have not developed stroke, so I don't need what? Ataplex. Don't pick it. It's a trap. I have not developed stroke. I don't need Ataplex. Ataplex work really fast. It's dangerous. The patient is experiencing that. We want to prevent future use. This is anticoagulation. Anticoagulation. Test-taking strategy. You cannot pick one anticoagulation over the other. I'm using these questions to teach you guys how to answer questions. So this, by default, they are wrong. Therefore, you're left with antiplatelet. The embolization, the antiplatelet stabilize plaques so that they don't embolize and cause stroke. So when somebody you want to prevent stroke, you give them aspirin therapy or antiplatelet. So that's your right answer. And this is assessing the client with suspected meningitis. Look at the word, suspected meningitis. Which of the following finding will be most concerning? Once again, there is a word. I make it big, underline for you. Most. Key word is most. That means others are concerning. But if you have to prioritize, you got to be sharp. And when you are being sharp, you are not being expected. Take care of things that will kill the patient. Therefore, patient we suspect they have meningitis. Which of those is the most concerning? And you got to bring your content, right? You have to bring your content to figure out which is most concerning, right? Which of this is most concerning? I told you patient has meningitis. And when you're using prioritization, you are being sharp. Well, not an expected finding. Meningitis, you're going to get photophobia. Good luck with that. You're going to get neck stiffness. You're going to have Kennan sign. You're going to have Buzinski sign. By default, this is your answer. A rash in the patient who have meningitis, they develop in sepsis, meningococcal sepsis. Therefore, that's your priority. You can't choose photophobia and leave neck stiffness behind. The skin system with meningitis. You can't choose Brzezinski and leave Koenig sign behind. It's all consistent with that. This is how you do test-taking strategy. And try to answer questions based on what they ask you. Okay, so your answer is D. Okay, I did not select any answer. So, which teaching is appropriate at discharge for a client with Parkinson's disease prescribed Carbidopa-Levodopa? A one-line question. It's a pharmacology question. Patient has Parkinson, and they give them Carbidopa-Levodopa. You know, Parkinson, there's decreased dopamine, right? And they have too much acetylcholine. So if I'm giving you medication, it's going to give you dopamine. And dopamine help with movement, right? The side effect of this medication you have to know, right? The medication, it does not like protein. So increasing your protein intake is bad, right? It causes orthostatic hypotension. And therefore, this is what this is saying. You got to look at the rest of the answers and see if there's any other option. Take the medication on empty stomach. It causes GI upset. So this is not a good option. Take muscle relaxant with frequent twitching. If you're twitching too much, you're developing tardive dyskinesia. It's not good. Therefore, best answer is orthostatic hypertension. This patient will fall. 4 weeks is the biggest problem for them. And I give you the Spanish. Which next action is a priority for a client in the emergency room with unilateral weakness, facial drooping 90 minutes ago? Go for the buzzword, guys. Go for the buzzword. What is the buzzword? Facial drooping, unilateral weakness. It happened 90 minutes ago. Facial drooping, unilateral weakness. You know this is stroke, right? Therefore, what do you want to do? Get an MRI, start, give them, prepare for thrombolytic therapy within 4.5 hours, obtain speech therapy, start, or get a lumbar puncture. Prioritization 101, based on your content. What do you think you should do? Patient has stroke, right? What do you think you should do? Everybody know when you have stroke, we got to look into your head. But MRI is not what is used. In a MRI, it takes some time. It can take like 6 hours to do MRI. It can take a long time to do MRI. CT scan is the diagnosis of stroke, not MRI. So just because you're going to think you're going to do something does not indicate, you know, that we look into your brain doesn't mean you got to use MRI. So don't use MRI, right? We're going to give them thrombolytic therapy. This question is true. So you can prepare for that. Speech therapy is not going to help you at this time. Lumbar puncture is a bad option. So it's between A and B. We don't get MRI for acute stroke, right? We get CT scan first. Therefore, I would choose number B. Okay, don't fall for it. And this is caring for a client with new onset of Guillain-Barré syndrome. Which of the following assessment is a priority? All I told you is patient has GBS. So you have to bring your content and know what is GBS, ascending paralysis. From your leg to your knee, your abdomen, your neck, and your chest, and your upper extremities. So which of those do you think is the most important thing to know about this patient if you have to follow up on this patient, right? They will die from respiratory problem. So your reflexes is going to go down. I don't care about it. Respiratory rate is going to go down. I care about it. Bowel sounds is going to go down. I don't care about it. Their motor and sensory function is going to go down. I don't care about it. So these are things you have to pay attention to based on the content. You just focus on the buzzword, GBS. I care about the airway. So pick an answer. Don't worry about the other function related to that. And this is doing morning assessment on the client with T5 spinal cord injury after a fall. Which findings should the nurse should be reported immediately to the air care provider? Another keyword, look at the question, and I can tell you this is your buzzword right there. T5 spinal cord fracture. Right. And which one you need to report is a priority. All these things may be bad. Heart rate of 59, headache, and nasal congestion, decreased breath sound and lung basis, and the blood pressure of this. They are all not great. But if you have to pick one, if you have 1 second, which one would you pick to take care of this patient? That's all. Which one would you pick to confirm the diagnosis? In your board, you take a test and they give you T6 injury above T6. Always think about autonomic dysreflexia. That's all. You don't have to think about anything. If they give you somebody with the injury above T6, always think about it. So this is autonomic dysreflexia. It's the same thing like somebody ICP is high. Therefore, which of those indicate ICP is high, right? And which is dangerous, right? So when they have autonomic dysreflexia, right, they're going to be hypertensive. They're going to be bradycardia, but this is not that bad, 59. Compared to headache and nasal congestion, this is bad ICP. Decreased breath sound on long basis because he has spinal cord injury is suspected. So that's not an airway. Decreased breath sound and long basis. When you see it anywhere in a question and you see it, never pick it. Decreased breath sound at long basis is normal. Athleticism. It's a spinal cord injury. It's paralyzed. So I expect that. So headache and nasal congestion is bad. It shows you urgency. So ICP issue. A client with multiple sclerosis is admitted with new onset of urinary retention. What is the best intervention to manage this condition? The word is best, again, best. Neurology questions are a little bit hard, but don't make it hard. Always go with the concept and the buzzword. You know, multiple sclerosis patients are going to have urinary retention. This is the first time the patient have it. What will be your best option? Best means it's going to be more productive rather than intervene to the problem right now. Putting a catheter in drilling catheter, give them diphenhydramine, perform intermittent catheterization, and limit their fluid intake to 1 liter so that they don't pee. Is that what you want to do? Think about it. The question said best intervention for this patient. What do you think will be best for them? If you give them diphenhydramine, is an anticholinergic, more urinary retention, bad problem. You should not limit their fluid intake because they're going to get constipation already, right? If you leave the catheter in, you get infection. So intermittent catheterization is much better. So that's much better. And this is caring for a client with Myasthenia gravis. Which intervention the nurse should prioritize? Same thing. No information in the question. When you see questions like that, sit back. Don't answer the question, underline keyword. Myasthenia gravis. What do you know about it? You have acetylcholine receptors being blocked. So if you increase acetylcholine receptors, it's fine. It will help them. You give them neostigmine or physiostigmine. What is their major problem? They're strong during the day and weak at night. In the morning, they're strong, right? And therefore, when you are planning care, you got to focus on that. And then you have to know what is the priority for myasthenia gravis. That's all. Before then you spend 5 seconds, 10 seconds to see what I did, and you look at the question, you know what to expect. Priority for myasthenia gravis is airway. I'll keep you supine. You're going to aspirate. We have a problem. They have dysphagia. They can't swallow well. Schedule physical therapy at night. They're weak at night. It's a bad idea. Recommend high calorie, small portion meal 6 times a day, or encourage fluid 2 to 3 liters of water a day. You got to be careful. They may aspirate, so they have to have some fluid that is thick that they cannot aspirate on it. High calorie, small frequent meal means you want them to eat multiple times a day. That is good because they're going to have swallowing problem. So eat more frequent meal is much better for these patients rather than giving them large meal at a time to prevent aspiration. And this is assessing a client who was admitted with stroke affecting the left cerebral hemisphere. Which of the following findings should the nurse suspect? So when they give you a stroke patient, be careful so that you don't get trapped. I said what? Left cerebral hemisphere. That means if this is your brain, the left side is where the stroke is. It is the right side. When you have left side stroke, it's going to affect right side of your body. And if you have right side stroke, it affects the left side of your body. The left side is where your speech function is located. The right side is where your emotion, your impulsive is located. Therefore, I have left-sided cerebral, I'm not going to be impulsive. I have left-sided, my right side of my body will be affected. I'm not going to have left-sided weakness either. Speech impairment, that's where speech is located. You see, so all these answers, you just have to look at a question and then break it down. You can see the answer there will be waiting for you. I call it popping like a candy because you don't have to stress too much. If you bring the content, so you try to find some place where to learn your content, and when you answer questions, you don't sweat too much. And next, administer Lorazepam IV to a client with severe anxiety. Which priority action the nurse should take? Keyword, right? Lorazepam. I give you Lorazepam, right? IV for anxiety. What should I do? I check your level of consciousness. I check whether the anxiety has gone away. I monitor your urine output or your respiratory rate. The anxiety is gone away. You check if the anxiety is gone, it's irrelevant, right? It's irrelevant. This medication, Lorazepam, is what? Central nervous system depressant. So all your symptoms is going to start going down, right? So you check, number one, is their respiratory status that is going to be affected. This anxiety is going to go away. Who cares, right? That's not the priority. The medication is a central nervous system depressant. I'm going to check their respiratory rate before I check their level of consciousness, right? I want to make sure they're breathing. So that's more important than A. Urine output is unrelated. And next care for a client post-lumbar laminectomy. Have you seen a question about laminectomy? It's just basically you have a disc problem, they're trying to fix it. It's a spine surgery. Don't worry about it. If you see a procedure you never seen before, so far as you said laminectomy, replace this as what? Spine surgery. Don't freak out. Don't worry that, oh, I don't know what laminectomy is. I have spine surgery. That's all. And cancel the laminectomy. Don't think about it. If somebody have a spine surgery, what would you do? You let them roll on their side by changing the position using the side rail. You let them flex their knee to change position, or you log roll them. Or you let them practice coughing violently. Right? What would you do? Spine surgery, concept, maintain alignment. Which of these answers maintain alignment? That's how you answer the question. So which of this is going to maintain alignment? If they use the side rail, they're going to bend their knees, flex it, put more pressure on their back. It's not good. You flex knee, it's not good. Right? You log roll them, they remain flat, spine. Off cuff, put too much pressure on the back and the cerebrospinal fluid. It's not a good answer. So take the concept and then find the answer based on the concept. A charge nurse is making room assignment. Which client should be assigned to a room close to the nursing station? Whenever you see this question, think about safety and somebody who can get sick quickly. So The client has left hemispheric stroke who need assistance with walking. He has stroke and he need assistance to walk. Client has pneumonia and urinary retention. He has Foley in place and is getting IV antibiotic. Client has UTI. He's reporting some bugs crawling on the skin and he's getting antibiotic. A client with varicella infection who is on airborne precaution. Who would you put near the nursing station? That is the question. Look at each of them, see who is in trouble, who we need to follow up on more frequently, and who should we see, right? Airborne precaution does not guarantee you to be in nursing station. We want you to stay away, far away from us, right? You had a stroke or what? You have urinary retention, you're getting antibiotic, you have UTI, you're reporting bars crawling on your skin, and then you see the antibiotic. Which of this would you think we need to see first? Or we need to send to the nursing station? This is very good question to make you think. Yeah, and it's easy to get trapped. If you pick A, it's wrong. Okay, the patient has stroke, right? You need assistance to walk. Fine, right? That's that because you need help to walk. We put him in a nursing station, maybe. But look at this patient. This guy has pneumonia, urinary retention. He's getting antibiotic. He has a lot of lines. Does he need nursing station? Maybe. This guy has UTI. And now he's seeing bugs crawling on his skin. He's hallucinating. He's in delirium. He's getting septic. He will try and get out. This guy will not get out because he needs assistance to walk. He's not going to get up unless there is somebody there. You put the bed alarm and say, don't get up when you're ready and call me. But this guy is seeing bugs crawling on the skin. He's delirious, right? He's very delirious. He's getting into delirium because of the sepsis. He will try and get up and fall. So watch for it. Watch for it. Be careful. This is the person that needs to be seen and put in the nursing station. So that guy is more dangerous. The nurse has attended staff education program on glaucoma. How much do you know about glaucoma? Which finding the nurse know is consistent with open angle glaucoma? Not a lot of information. There's only one buzzword, glaucoma, consistent. Is an open angle glaucoma. That's your key. There's a closed angle and an open or acute angle glaucoma or open angle. You have to master them because they can be confusing. Which one? It affects one eye, it's acute onset, it increases intraocular pressure, you occur gradually with the peripheral loss of vision. You can treat it with the eye drops or you use a trabeculectomy. Which of those do you expect in a patient with open angle glaucoma? There's two types of glaucoma. There's one that occur acutely, patient will come in with pain, and then there's one that doesn't come in acutely. So which one? There's two types of glaucoma. Open angle glaucoma affects both eyes. It's bilateral. It affects both eyes. Anybody who comes to the clinic with glaucoma most of the time has open angle glaucoma. Both of the eyes is affected. It's not acute onset, it's gradual onset of loss of peripheral vision. So you can see on the peripheral. So you do a tunnel vision right in the middle. That's what you can see. Because of that, it's due to increase intraocular pressure, right? And there's a gradual loss of vision. You can use eye drops to treat it, or you can take the trabecular opening. So this is the treatment for um open angle glaucoma. But it's not acute onset. It does not affect only one eye, affect both eyes, and it's an emergency. So this guy, that guy, four. These are your answer. And let's care for a client who is post laminectomy. We already talked about this, but I just want to give you the content here. So some people ask me about laminectomy. Which of the following the nurse should include in the plan of care? The same thing. If you don't know laminectomy, don't worry about it. Just ignore it. It's a spine surgery. If spine surgery, I should keep you flat. Keep client flat with head of the bed elevated for a few days. Excellent, right? Place small pillow under their head, yeah, to support them. If they lay on their side, keep them flat by using something to support the upper leg. You log roll them every 2 hours to take pressure off the incision and avoid straining or coughing or something like that that will cause pressure in the cerebrospinal fluid. So that's why you do that. So this is the things you teach the patient what you do after laminectomy. And this is caring for a school-age client with concussion after a fall. Which finding is the most concerning? Once again, most concerning, most concerning, most concerning. Which of this is most concerning? Patient had a concussion. Which of this, when you see, you should be worried about? A report of headache, he has nausea, decreased motor response, and increased sleepiness. Which of this is a little bit hard, but look at it. Most concerning after concussion. What do you think? Which is most concerning? Headache is a brain trauma to the brain. There is no bleeding. That's why it's called concussion. So you concussive. But if I see you have a headache, I see you have nausea, I see you have decreased motor response and sleepiness, which one is more dangerous? Concussion means you have TBI, traumatic brain injury. Early signs of brain injury, you get headache. You have nausea, you may vomit, you may have sleepiness. Late sign to start having neurological symptoms. This is motor symptoms. This is bad. That's why we do GCS, right? EMV, right? Motor. Motor function. When it start having decortication or deceleration or decreased motor function, that means you have severe brain injury. So these are all early signs. Nausea, and headache and sleepiness, but motor function is more dangerous. It's the same question I said, but different kind of idea. So this one is motor is more dangerous. And this is caring for an elderly client admitted for UTI 12 hours ago who was alert, oriented, but now confused, less responsive with global memory loss. Client is oriented to person only. Which of the following the nurse should suspect? You see, so this is the way they will ask you the question and set it in the same way. But if you follow the way it flow, you'll get it wrong. Patient has UTI 12 hours ago. It's alert and oriented. All of a sudden, it's confused, less responsive, and global memory loss. There's a memory loss problem. Patient is only oriented to person, right? Oriented to only person, right? Which of the following the nurse should expect? Is it dementia, depression, delirium, or stroke? I'll take depression out of it. It can be. This is an acute onset. It can be dementia either. It can be stroke or delirium. But there's no evidence of slurred speech, weakness. All I have is confusion and memory problem. Test taking strategy. You left with delirium, right? It's a buzzword. There was a buzzword there. You can hear it. A client with bipolar word control on lithium asks a nurse at the neurology clinic, can I take Motrin for my headache? What is the best response? Content, content with mental health and neurology combined. I have bipolar, I take lithium, and I have headache. Can I take what? Can I take Motrin? Yeah, Motrin will decrease the lithium level in your blood. You should try Advil for your headache. I recommend acetaminophen for your headache. Yes, you can take Motrin for your headache. Which one sound good? What is the content related to Motrin, bipolar, and headache? So headache, Motrin, bipolar. Right? If I take lithium, it's helping with my bipolar. If you take Motrin, it affects your kidney. Your kidney function goes down, lithium goes up. Therefore, lithium does not decrease, it increase in the presence of Motrin. Advil, the same as in the Motrin group, right? Ibuprofen, they are the same NSAIDs. Since A and C are wrong, this has to be wrong. And you left with this, elimination by taxes. So if you know the content, you see, like, you don't have to struggle, right? So just find a place, that you can master this, and you'll be fine. Which of the following clients should receive priority for a nurse assessment at the beginning of the shift? That means, who do you see first? Who are you going to see first? The client with Myasthenia Gravis reporting blur vision. So there's certain condition you have to pay attention. Myasthenia Gravis, I have blur vision. I have left-sided stroke, and I'm reporting right-sided weakness, right? I fell down 12 hours ago, and all of a sudden, now I'm lethargic and I'm confused. I have Guillain-Barré syndrome, and both of my leg doesn't work. Who will you go to see? If you have, once again, who will you give it to? Who you think deserve your time? That's all. If nobody deserves your time, at least give one person your second. I see that you may going to have blur vision. If that is the thing, yeah. So if you choose A, it's wrong, because this is what I expect. If you have left side stroke, you're going to have right sided weakness. It's suspected. I'm not saying patient is having trouble. If you fell out of bed and now you're lethargic, you're confused, A, you're bleeding in your head, bad. If you have GBS, your leg is going to be weak. It's not a problem. And this is evaluating a client with gunshot wound to their head. Okay, this is a gunshot wound to the head. Which finding is concerning? This is the patient. He gets shot in the head. Now he has bradycardia, hypertension. He has projectile vomiting, hypotension. He has tachycardia, hypertension. He has decortical posturing and tachycardia. Next level thinking. But who do you think, symptoms-wise, that is very concerning to you? That's all. They are bad symptoms. But who do you think? Which one is bad? When you have brain injury, TBI, yeah, you're going to vomit. You're not going to be hypertensive. You're not going to be tachycardic, right? You see what I've done? I've given you the answer just using content. Look at this question carefully. When you have brain injury and it's very severe, TBI, I get shot in the head, you're not going to be hypotensive, right, in your head. If there's severe TBI, no hypertension, you're not going to be tachycardic, right? Therefore, D is gone. Decorticate is bad injury, right? Hypertension, it means you're about to herniate. Projectile vomiting is early TBI, like ICP is going up. So this is early sign. When you have bradycardia, you have hypertension and irregular breathing, change stroke breathing. This is what we call Cushing phenomenon. You have herniation. Your brain is coming out of your head, and that is a prioritization. So anybody with the brain injury, with bradycardia, hypertension, it's this. I know a lot of people will pick this. I know a lot of people will pick that, but it does not answer the question. So just be careful. Let's go with the content. That one. And then is assessing a client with closed head injury. This is the same thing, but change it, right? Closed head injury. Which action should the nurse take first? Assess their vitals, assess the sensation, assess their level of consciousness, assess motor response. So which one would you assess first? If somebody comes to the emergency room and you have to assess them, which one would you do? So they got to protect their airway. If they have to protect their airway, which answer choice indicates like you checking something to protect their airway? That's all. You see, I did not give you the answer, but I give you a content you can use. Somebody coming with head injury. The number one is to protect the airway. Which of this indicates that you can use it to check if the patient can protect their airway? And when you do that, you see the answer is right there for you, right? So everybody choose C. I'm going to choose C for you. And you see right there. Don't choose D. Motor function is not going to tell you how to protect the airway. And the last question. RNA UAP cares for a client who experienced right-sided stroke. I've given you the key about that. Right-sided stroke, it means the brain, okay? Right-sided stroke. Which action by the UAP need immediate intervention? Position the client upright during feeding at 90 degrees. Tilt the client chin slightly downward during feeding. Modifying food consistency to meet the client's need. Providing puree liquid. Which of these actions by the UAP require intervention? Which of this? You got to protect aspiration. Which answer choice is protecting aspiration? If it's not, you got to pick it. Giving them full consistency to meet their needs, depending on what they can take, is good. If you tilt their head downward, that will elevate the epiglottis, it will close the airway, and that is good. You keep them upright, it prevents aspiration. Thin liquid, they can aspirate with it. Usually we give them something thick, nectar thick, and they can take it easily. But thin is easy to get to the airway. So that's the right answer. Thank you for watching. Thank you for joining Adapt class today. If you want more, just subscribe. You get more video, or you can join our on-demand on my website, on my YouTube membership. We have 2 membership, Gold and NGN Gold. You can try the NCLEX challenge. Trust me, you will never go wrong.